I'm Dr. Regina Joseph. I'm a physician and I've done my graduation from St. John's Medical College and post-graduation from Bangalore Medical College. I've been practicing as a general physician for last 3 decades. Now I've been practicing as an aesthetician in Splendore Cosmetic Clinic, Bangalore. Urinary incontinence is the most common trend which is found, and it is unspoken in today's field of patient. The reason being, many would not like to express why they are having the urinary incontinence. The most common people of the age group of 30 to 60 years age group, and it is seen in 45% of the women population in the age group of 30 to 60 age group, where they do suffer from urinary incontinence. Urinary incontinence, it could be for several reasons. It could be stress urinary incontinence, urge urinary incontinence, or functional urinary incontinence, or total incontinence. When it comes to total incontinence, it could be due to various reasons. It could be malignancy, it can be neurological disorder for which the patient needs a definitive kind of a treatment. When it comes to the function is when they really don't have any particular reasons for which they do have urinary incontinence. These kind of patients can be subjected for counseling, where they need to go through the bladder training exercises and they do show overall improvement. Whereas in stress incontinence and urge incontinence, we have in cosmetic gynecology the several kind of treatment which helps the patient to undergo the procedures, namely like the PRP given, like shots is also given, which helps in the neogenesis of the urinary sphincter, which helps in controlling the urine. So it also helps in stress incontinence. PRP is done around the vagina for vaginal rejuvenation and also helps in stress incontinence. And all this urinary incontinence where we can handle in cosmetic gynecology is mainly very mild to moderate form and not the severe form. So this can be handled with the recent trend. What we have seen in cosmetic gynecology is giving the PRP shots and vaginal rejuvenation, which helps in neovascularization of the urinary sphincter and thus controls the urinary leakage. So it helps in improve the performance of the individual, and it reduces the anxiety, depression, and so many times the people become so withdrawn and they don't come out and openly speak. They naturally they go on suffering within themselves. So if they come up and if it is the diagnosis is made in cosmetic gynecology, it has got a wonderful result. I would really recommend PRP to the vagina and the vaginal walls along with the urinary sphincter, because the patient needn't go for the surgery and they don't have to spend huge money. And also we have seen the stress incontinence and urge incontinence when they have recurrent UTI where there is no organism seen, and this kind of patients also, this is seen most commonly after the childbirth delivery, and we are seen in perimenopausal, menopausal age group where there is decrease muscle tone or decrease in the muscle or more in the muscle weakness, which causes stress incontinence and urge incontinence, which can be without the patient going for the surgery. These procedures can be done in cosmetic gynecology. It has got a wonderful result. We also give laser treatment for which they can come as a daycare procedure. Patient can spend about 15 minutes time in the hospital. The procedure is done. Maybe they need about 3 to 4 sessions or sometimes 6 sessions, and they can come back after an interval of 1 year for the follow-up studies. And it has got an amazing result and is highly recommended in today's modern world, where we have in cosmetic gynecology, where we can do so many things to the patient in a short given time of period with a less cost and as a no downtime, and patient just can get back to the office duty. So I would recommend in cosmetic gynecology the stress incontinence management.